Do I have your permission to use this video for my online DAT course, Corrective Techniques for Movement Dysfunction?
Yes.
Okay, so this week we are doing the hip hinge progressive exercises. For my assessment tool for this week, I chose hamstring flexibility and the deep squat in the FMS screening to test, since both of those are necessary for the ability to do a deadlift, squat, and all of these progression exercises through the hinge. Okay, so first we're just going to test hamstring flexibility. Okay, and now he's going to perform a deep squat. He's going to do a couple on the ground and a few of them up on the platform. Okay, so the first exercise that I chose in the progression for the hip hinge was a hip thrust. In this exercise, the patient starts on the ground, and it's really called the supine hinge. It allows the patient to learn how to perform the skill before they move to a standing position. So what he's going to do is stretch out his arms along the pad or the bench, depending on what you have. His knees are going to be in a 90-degree angle. I'm going to have him tighten at the abs in the low back to activate that area, and then he's going to push up through his glutes and his quads. And once he gets up, I want him to emphasize going up just a little bit beyond neutral and then come back down, and he's going to go through 5 of those exercises. This exercise works on feedback with 3 points of contact. So the dowel should be on the posterior side of the body, contact with the back of the head, the upper thoracic spine, and the sacrum area. This is a hip-driven exercise that teaches the proper technique of the hip hinge, and it also allows that feedback if at any time one of those points of contacts disappears, then we need to start over and figure out what correction needs to be done. There should be minimal movement at the knees. The pressure should be on the heels of the feet. There should be a good stretch of the hamstring and an explosion of the glutes as he comes back up into extension. And he's going to do 5 of these. A little bit more movement. We're going to use the wall. He should just take one short step away from the wall. It's performing the same exercise that we just did with the dowel, but now he's got the feedback coming from the wall. As soon as he hits the wall, that should let him know that he's ready to explode up through his glutes and stand up. He's going to do 5 of these. This is really working on developing core activation and activating those glutes with minimal knee flexion, and he should be keeping his eyes and head facing forward. Again, it's not in a standing position, so what he's going to do is stabilize his core and really lean backwards into his heel and then try to explode back up into the position that he's starting in. He's going to do 5 on the right and then switch and do 5 on the left. Hip rotation. It changes the base of support for the patient by going from double to single leg exercise, so it gives it a little bit more of a challenge, especially for your ankle and knee patients who still have some proprioceptive issues. This person should work on proper breathing technique, stabilizing the core before they begin the movement, and as they go through it, making sure that they continue to hold that neutral spine, forward head and eye position. Allow for a good hamstring stretch for about 2 seconds with glute activation on the completion. Okay, so this exercise is really good for ankles, knees, and hip stability. And he's going to do 5. The next exercise is a kettlebell deadlift. This exercise is beneficial for the patient because they remain in the same center of gravity as a deadlift, but with decreasing stress placed on their lower back, which allows them to progress through this exercise properly with minimal risk of injury. The patient should perform the same as they would as a deadlift. They're just using the kettlebell in the front, tightening up the abs, glutes, and quadriceps all together to perform the pure motion. Okay, the next exercise in the progression is the kettlebell swings. This exercise is a quick, explosive movement that requires the patient to have functional movement patterns in their ankle, knee, hip, and low back. So all of the stability and core work and breathing that we've been working on is continuing until we can get to a full deadlift exercise. So he's going to perform 5 kettlebell swings. The last exercise in my progression is the deadlift. The deadlift is a good representation of a hip hinge and should be completed after a patient progresses through some of the exercises that I've shown today to work on those corrective techniques and then allow them to go into the full deadlift. Okay, for this patient, the feet are just a little bit past shoulder width apart. The grip is a little bit past shoulder width apart, and he's going to come to a straight standing position and explode through the hamstrings and the glutes.